Same as before, I'm still going to check my patient's chart to make sure that this is just a follow-on from getting the patient with the range of motion. But I'm going to check his chart, make sure there's no restrictions, name, date of birth, allergies, and I'm going to give him instructions as we go along. Okay, Mr. Arnold, so we're going to get you up and sit you in your chair today, okay? So last week we talked about the gait belt, so I'm going to show you guys how to put that up as well. So a couple of different things, okay? So once we get to the point where we're going to get the patient up, if your patient can help you, you can do 2 people, 1 person, it really depends, okay? The side rail of the bed is going to help your patient. So I'll give him instructions. I'm going to want you to take your right hand and grab the side rail for me and turn on your side. Go ahead. Don't get up yet. Just turn on your side. Okay, perfect. At this stage, we're getting him ready so he can able to like sit up and help you with that, okay? Now, we can help our patient. So I'm going to take his legs and I'm going to swing his legs around. And then I'm going to grab him by the shoulders. You can grab around my waist, that's fine. And we're going to sit him up. Okay? Alrighty. Alright. Okay. I'm always going to also tell my patient to scoot forward so their feet flat on the floor over there. We'll sit him here for maybe a minute or 2 so he can just equalize and stuff. Any dizziness, lightheadedness or anything like that? No? Okay, perfect. So at this stage, I'll also make sure that my patient has non-skid socks on or their slippers have some grip on it at least. I'll put on their nightgown and everything if they have one of those. Just make sure that they are covered and protected in the back. If I need to give them an extra nightgown, I can do that as well, or an extra gown. So at this stage, I'm going to go ahead and we'll put the gait belt on. So I'm going to put it around his waist. It's going to be higher up, so it's almost under the breast. If your patient has breasts, like females obviously do, we're going to make sure that we, just turn it around, sorry. That we tell them to help you by lifting it up so you are able to actually put the gait belt on. So the way that it looks, it has teeth and stuff in there so it will actually grab it. So I'm going to feed it through and we'll practice this when we see you in a couple of weeks just so you know how to use the gait belt. And I'm going to make sure that it's nice and tight. So when we say nice and tight, we want to make sure that you at least be able to get 2 fingers underneath. We never grip it this way because we don't want our fingers to get caught, okay? And then we're going to go ahead. It's not too tight, is it, Mr. Arnold? Okay. Then we're going to feed it through and then just loop it through, okay? All right. So, couple of other instructions, okay? If your patient has weakness in their legs or leg or hip, it really depends, okay? We're going to use our knees to balance them out. So, more instructions now. The chair that we're going to use, we want to make sure that it has armrests on. We're going to bring the chair as close as possible if we can, okay? If it does have wheel locks, you want to make sure that's locked as well, so it's not moving around, okay? This is so your patient can hold on to it when they actually sit down. So, instructions. Tell the patient to take their hands and put them on their shoulders or around your waist, okay? Shoulders are most probably going to be easier and better. We never tell them to pull on your neck and stuff because they can pull you down when you try and stand them up, okay? So that's the first thing. So go ahead and take your hands for me. Put them on my shoulders. Okay, bring your legs a little bit closer. There you are. If your patient is able and they don't have any restrictions, you don't have to do this. You can have a wider stance to be able to help them. So last week you guys watched the video and it gave you specific instructions with regards to your positioning so you can protect your back. So it's always using the big muscles in your leg. You're going to bend, booty out, back straight, shoulders back, okay? That's how you want to do it. That's how you're going to make sure you'll protect your back. So I'll pretend like my patient has a weakness in his legs, okay? So I'm going to go ahead and grab the belt, okay? He has his arms. Mr. Arnold, what I'm going to do is on the count of 3, okay? We're going to rock backwards and forwards, but on 3, we're going to stand you up, okay? So don't get up before that. Okay. So I'm going to put my knees against his. And when I stand him up, I'm actually pushing and forcing his knees in. So I'm going to show you guys, okay? So we're going to rock. 1, 2, and then 3. Okay. All right, so we'll stand him up just for a few seconds. Are you feeling dizzy or anything? No? Okay. And then we're going to go ahead and turn around, okay? All right. So at this stage, I want you to move back, Mr. Arnold, so you can feel the chair against the back of your knees, okay? Take your hands for me and put it on the armrest, both sides, and then go ahead and sit down. Okay. All right. If the patient wants to, because they feel more secure, you can leave the gate belt on. If they don't want it on, just take it off and then leave it in the room. Most of the gate belts in the hospitals are plastic, so we just leave it in the patient's room so we can reuse it. And we can always just wipe it down if it does become contaminated. At this stage, I'll take the gate belt off. I'll give my patient his call light, give him his cell phone or any personal belongings, make sure he has something to drink, and then we'll leave the room, and then we'll go and we'll document if there was a problem. And then we'll talk a little bit more about the skill as well when we see you tomorrow. Thank you.